of the commissioners elected last time and none this time?
Yes, every election, all 9 commissioners are up for election.
They're up this time too?
No.
Okay,
We
it's
got,
already, yeah, I thought so, but I wasn't sure.
We've got, well, there'll be an
all
election
that
2
years.
years. Got 2 more years.
Yeah,
And they'll run. I always thought it crazy that we have 9 commissioners that are all elected in the same year.
yeah,
But that's, theoretically, you could have 9 brand new commissioners.
I know. Not smart.
It's crazy.
Ought to be staggered.
Yeah.
All right, I'd like to call the August 19th Board of Health meeting to order. First, we'll seek the approval of the agenda for today.
I'm going to approve today's agenda.
Support.
All right, all those in favor? Any opposed? All right, the agenda is approved as stands. Now we'll seek the approval of the minutes from July 15th, 2026 meeting.
I move to approve the minutes
Support.
from the July meeting.
All right, all those in favor, say aye.
Aye.
Any opposed? All right, we'll move on to our reports. We'll do the accounts payable report first.
Good afternoon. What questions do you have for me this month?
Just a few.
All right.
Since I wasn't here last month, I have to make sure I ask just a few. On page 1 and 2, the Amazon for emergency preparedness, I'm assuming that's books.
Mhm.
Okay. And down on page 2, about middle of the page, material management plan consulting services.
Yeah, that is, that's a Casey question.
Okay,
So that is under our solid waste materials management.
got it.
As part of putting together the required bylaw materials management plan, we hired some consultants. So they have started to do their part of that plan, actually more than started. But that's what that is for.
Okay. And next item down, MOOG grant.
That is Health Promotions Now, the marijuana outreach grant.
Okay,
That was just some additional supplies. We were running through them rather quickly. So, like first aid kit, sanitizers and locks.
all right, any other questions on our accounts payable?
I have a question. Oh, sorry.
Go ahead.
On page 1,
Mhm.
the dental contractor, is that a yearly?
It is, it's an
Fee?
annual fee,
Okay.
because we have the kindergarten oral health assessment program.
Okay.
We have the coordinator within house, but the dentists and the hygienists are supplied through this company to go into with the coordinator into the schools to do screenings.
Okay, great. Thanks.
Terry?
My question.
All right. If there are no other questions, I'll seek approval of our accounts payable.
So moved.
Support.
All right, all those in favor?
Aye.
Any opposed? All right, we'll move on to our health officer's report.
Good afternoon. A couple of events that are coming up. The Adrian Area Health Check will be at the Align Center September 24th from 8 to 2. Project Connect will be at the Lenawee County Fair Merchants Building on October 28th from 10 a.m. to 1:30 p.m. A few of the monthly reports updates. Respiratory illnesses are very low. Transmission levels have not changed over the last month. There has been no additional detections of avian influenza since March. Measles cases throughout the state of Michigan now stand at 16. There has been none in Lenawee County. Foodborne illnesses have been keeping the clinic department and communicable disease very busy. The cyclospora regarding the iceberg lettuce recall, that response has slowed some. We are still getting cases, but it has slowed drastically. As of last Thursday, we had 414 cases that were reported by MDHHS, and it is a 17-state outbreak in this investigation. Salmonella has been in the news recently. Jalapenos were recalled on 8/14. This is a 27-state outbreak investigation and no confirmed cases in Lenawee at this time. Also, there was eggs recalled, Midwest Poultry Services on 7/21. This is a 17-state outbreak investigation. As of this time, there are no cases, confirmed cases in Lenawee County. Recently, there was a H1N2 detected in a human influenza case. This is a result from August 3rd through 8th fair where a pig died suddenly on 8/7, and then the human case was detected on 8/14. CDC indicates that the risk to the general public remains low. And recently, just today, there was a case of triple E in a human case in the state of Michigan, and also West Nile in August was detected in a human case as well. If there's any questions, I would be happy to answer them.
How did your stint at the fairgrounds go when the fair was, Lenawee County Fair was on?
Very busy. There was lots of people that came through the barn and received education and goodies. They liked the goodies, so it was good.
Good.
Any other questions for Monica? Go ahead.
What is the status now with lettuce? If it's locally grown, do we feel safe or? Bug you on the spot.
MDHHS has said that you can resume normal, consumption of lettuce just to make sure that you are washing it. Everything that was in the outbreak has now processed through, and the expiration date, I think, was early August or something like that. So it should be all out of all, areas and restaurants and things like that. The restaurants stopped serving them. As far as any items in the stores, those should have been already expired, so you should be safe.
Spoken like a true politician.
Thank you.
All right. Thank you, Monica. All right, time for our medical director update with Dr. Chernin.
Oh, got me? Okay. So I was asked by Monica and Dr. Tritt to do a presentation on Lyme disease. So this is what I passed out to you all. So it's a 6-pager. I'll try to be brief, summarize. Spend a little time on it. We don't talk about Lyme disease very much anymore. And I think Natalie will give us some updates on how many Lyme disease we actually have in the county. I haven't noticed many ticks recently on dogs. I don't know if you've seen any, but you see them all the time. Yeah, we have a dog living with us and haven't seen many ticks recently. I saw a lot in the spring. Maybe it's too hot, I'm not sure, or maybe that we don't have many ticks in my neighborhood, but I think we do. Anyway, so let's talk about Lyme disease. It was certainly in the news quite a few years ago, and it's become endemic in Michigan, actually. So it's a bacterial infection in the U.S. It's caused by a spirochete bacteria called Borrelia burgdorferi. And this spirochete is similar to the syphilis bacteria that causes syphilis. It's an interesting little bacteria. It's transmitted by the black-legged or deer tick, and it seems to be mostly in the northeast, and upper Midwest, which I'll talk a little bit more in a moment. CDC estimates that 476,000 Americans are diagnosed and treated for Lyme disease every year. So it's 500,000 people. It's a lot of people. Mm-hmm. It's the most common vector-borne disease in the U.S. Vector meaning there's a animal between the human and the bacteria. And it's highest in persons who spend time, obviously, in woods, brushy areas and grassy habitats, especially May through November. So now would be a time that you would see a lot of it. The tick isn't born infected. It actually, the nymphal and larval ticks acquire Borrelia while feeding on infected reservoir animals such as small mammals, particularly the white-tailed mice, and in some areas, the gray squirrels and deer as well. It's the female tick that causes the problem because it attached to humans and it's taking a blood meal and basically giving that to give the blood to their offspring. The greatest risk is broadly distributed as follows. Northern New England, Maine, Vermont, New Hampshire, Massachusetts, and Connecticut. High incidence there, about 195 cases per 100,000 people. That's a lot. Lyme actually, the name Lyme disease actually came from Lyme, Connecticut, where it was first discovered, quite a few years ago, so several decades ago. Lyme, Connecticut was where they found it and were able to diagnose it finally. We see the most actually in the Northeast and Mid-Atlantic, especially New York and Pennsylvania, which seems to be the major centers of Lyme disease now. We'll also see it in the upper Midwest, especially Wisconsin and Minnesota, but it has now come into Michigan. For a while, it was only in the UP in area, and then it kind of moved down to the southwest part of Michigan, but now it's pretty much all over Michigan, including Lenawee County, Washtenaw County. We see some in the West Coast. It's a little different black-legged tick, but the incidence is much lower. And the South and the Southeast is actually much less common. So it's kind of interesting that it sort of affects the north areas of this country. So there's 3 major stages of Lyme disease. We'll go over that. There's the early localized Lyme disease. Usually occurs days to weeks after a tick bite. The hallmark of this is erythema migrans, which is sort of a large bullet-sized rash. About 70% of people or so, between 50 and 70% of people get this large rash, and it's 5 centimeters in diameter. So it's a fairly big rash. It's pretty characteristic, but not everybody gets it. And not all of it looks like the bullet rash, so you have to be careful. But if you ever get a big rash, and if you know you were bitten by a tick, then that's a sign that it could be Lyme disease. They're as I said, they're pretty characteristic because they're large. Oftentimes with that, for early stage Lyme disease, you'll get a fatigue, headache, fever, muscle pains, arthritic pains, and sometimes your lymph glands swell. It's called lymphadenopathy. It's treated with this stage is 100 milligrams twice daily for 10 days, amoxicillin 500 3 times a day. There's a cephalosporin drug that you take twice a day for 14 days. So the typical rash is a good indication that it is Lyme disease, but we don't wait for the antibody test to tell us that it's because there are antibody tests for Lyme, because the Lyme disease antibody takes 6 weeks to unfold, so you really can't wait. So you'd rather treat a little bit more aggressively and not wait for the antibody to become positive. Without treatment, organisms can disseminate through the bloodstream and the tissues, and this gets you into this early what's called disseminated Lyme disease. And it's spread beyond the initial skin infection. It leads into the facial nerve, which causes facial nerve palsy, where your facial actually get paralyzed. It causes meningitis, actually, where lymph glands go into the meningeal parts of our body, the meninges of the brain, and cause neuritis. It causes like sciatic nerve or nerve coming from the cervical area. Other cranial neuropathies, the cranial nerves, we have 12 cranial nerves, and they can get into the cranial nerves. This is a pretty serious disease. And also the heart, Lyme carditis, and that can actually kill, and also cause an AV block in the heart, which is a problem in terms of electrical conductivity of the heart. So for that, you treat with doxycycline and ceftriaxone, usually for 14 to 21 days. Usually oral is okay, but sometimes if it's bad enough, you have to take IV. So the late Lyme disease develops months or occasionally years later after untreated the disease. And this can lead not only to the continual heart disease, but also can get into the joints. I've seen one case in my career. I have had a family practice, and I saw Lyme disease, and the knee was like super big, super swollen. It's kind of scary looking, actually. Tends to be go to the knee in particular, and that's where you take doxycycline, which is a derivative of tetracycline, and take that twice a day for 28 days. So the clinical framework is tick bite, early Lyme disease, early disseminated disease with neurologic, cardiac, and multiple organs, late disease, especially arthritis. That's the clinical progression.
Can you get to the late disease without ever having known you had?
It is possible.
Mhm.
It's rare because usually you get sick in the beginning, like you feel like a flu.
Uh-huh.
But if you don't know you've been bitten by a tick
Mhm.
and you don't get the typical rash, it definitely can develop. It's something that you really have to watch out for. As a clinician, and as in the health department, we really have to be careful about, diagnosing it or misdiagnosing it. So that, as I mentioned before, the testing, it takes 4 to 6 weeks for the test to become positive. The body produces antibody to the bacteria, the spirochete bacteria. So the sensitivity is pretty low. Sensitivity means false negatives. So the false negatives in the beginning. So if you get a rash, you go to the doctor and the doctor says, well, we'll do a blood test, or you go to the ER or something. We'll do a blood test and it's negative. Say, well, we'll wait. And that's not a good idea because as I said, the test takes a while to become positive. Historically, this is a little more, we at the health department understand this, and I'll tell you what it is. There's two different antibodies that we're looking for. One is IgM, which usually is a test for early stage diseases like measles or Lyme. And there's something called IgG, which usually reflects a longer standing disease. Well, because the IgM if you see it later on in the disease and it's positive, that could be a false positive because they also, later on, it stays positive, but it's not necessarily still having Lyme disease. And the IgG can actually continue on for years, even after the disease was treated. So the testing is not great for Lyme disease. It's really a clinical diagnosis. So what happens during the blood meal? In general, the bacteria resides in the tick's midgut. It takes a while. Once it starts feeding on the blood of a human or an animal, what happens is it activates that midgut bacteria and it starts migrating to the salivary glands. And once it hits the salivary gland, that bacteria can be transmitted to the animal. That's why the tick has to be on for 24 to 36 hours for the person to get sick. You could get bitten by a tick that has this bacteria in it, and it's about, I can't really tell you how many percent, maybe 5, 10% of the ticks in this area have this bacteria. Not all bacteria, has to be the female of this particular tick, and has a certain configuration in the back. It's kind of orange. But it takes a while for the migration of the bacteria to get into the salivary glands to transmit it. So if you can get that tick off in 8 hours, you're going to be okay because it doesn't have enough time for the migration of the bacteria into the human host. So the transmission is not instantaneous. That's why the CDC and our health department emphasizes tick removal right away. So if you're out in the woods, look for ticks. You really have to look for them. They'll crawl right up your leg and really fast too. And they get on your leg and they can have them behind your ear. I remember this is before actually the Lyme disease became pathogenic in this area. I was lost in a bog in northern Wisconsin. I went with a friend and we got kind of lost. I must have had 100 ticks on me coming back. It was like unbelievable. I've spent like hours and hours picking these ticks off. It was terrible. And if it had been now, I would have said, well, I better take some tetracycline because you can take tetracycline right away. If you have a tick, and this actually happened to me not too long ago. I had a tick on my leg. I had no idea. I was walking in the woods with the dog and it got on me and it was all swollen like it had the blood, in it. So I took a dose of tetracycline, 200 milligrams. Doxycycline, 200 milligrams, the derivative of tetracycline. And that's considered curative or preventative. But that was, and I hadn't had any symptoms yet. So if you don't have symptoms, you can take just one dose. But if you start having symptoms like the rash or, constitutional symptoms like joint pain, then you have to take it for 10 days at least. Okay, so what's the prevention of Lyme disease? Well, obviously, prevent the bite, repellents, clothing, tick checks, landscaping measures, and the best thing to do is when you're out in the woods is to roll your pants into your socks. If you're wearing, I recommend when you go in the woods, you should wear pants, and then tuck it right in because then the tick will crawl up on your skin. It won't smell the skin. If it claws up, you'll see it generally. But if it gets underneath your pant leg, you won't see it and you won't even feel it. Remove the tick quickly if you see a tick. Again, 24 to 40 hours, you need to get it out by. Pull the tick straight out with the tweezers because you want to get the head out. And so you just pull it straight up, okay? Don't try to pick it out. Just get a tweezers and just pull it out. And then treatment after exposure. I said if you can do it within 24 to 40 hours, you can just take 200 milligrams of doxycycline. What's the vaccine research online? Well, there was a vaccine that came out for a while, but the FDA had pulled it off because they were having side effects and it wasn't very effective. But there is a new vaccine being experimented with and research by Pfizer and Valneva, which is in phase 3. It seems to be about 70% effective at preventing Lyme disease in people over 5 years old with no safety concerns. And so it's still being worked out through their various channels of the FDA. Now, Dr. Tritt asked me to discuss a research on a new drug, but it was not new for you because because of your work as a vet, but it is new for human beings. It's called lotilaner. And it's a fundamentally different approach. This is kind of interesting, actually. I find this very interesting. It actually allows a tick to attach. If the tick attaches, you're prevented because you take the drug before you actually go out in the woods. So say you're a worker, a landscaper, or you're working in, working in the woods for, some company that's, managing the woods that you're in. And so you might want to consider taking this if it actually passes the FDA. It's in phase 3 right now. And basically what it does, this is a little more complicated, but it basically kills a tick by disrupting the inhibitory signaling of the tick's nervous system. Okay, so every species, the higher species has a nervous system, including a tick like us. And it targets the tick's what's called GABA-gated chlorine channel. So what happens is the GABA is usually an inhibitory neurotransmitter. It's part of our normal, a neurotransmitter. And what it does when it binds the receptor, the chlorine ions enter this nerve cell or muscle cell, making it less excitable. So it's a relaxer. It's a relaxant. Well, what the lotilaner does, it acts as a non-competitive antagonist of the GABA receptors. So it's inhibiting the inhibitor in a sense. It prevents the normal chlorine ion flow, which chlorine, when it gets into the cell, relaxes the cell, causing it so the tick loses its important neurological braking system. It's the excitation is actually the excitation inhibition by GABA is actually inhibited, causing the tick to become hyperexcitable, and that's what kills the tick, right? So the tick gets the lotilaner into its body, it causes this inhibition of GABA, and then the tick dies because it gets too excited. There's various viruses work this way, like rabies, for instance. What kills people in rabies, which is like 100% awful, because it kills just about every human being that ever gets it, is not that the virus is doing something negative to the immune system. It actually causes an excitation in the human being. And so it's the excitation that actually kills the person. That's why people, when they get rabies, they go crazy, because then they start acting like they start barking and they start salivating, and basically there's an excitation of the nervous system, and that's what actually kills people. And so this is working in some of the same idea. This is not as serious as rabies, but has the same idea. The exciting part of this, in some ways, is that this particular drug may have applications for other tick diseases. Lyme is just one of many diseases that are transmitted by the tick, including Anaplasma, Babesiosis, Ehrlichia. The problem is that each tick that has different types of viruses and bacteria have different pathogenesis to it. So we know that the tick bacteria takes 24 to 48 hours, 24 to 36 hours to get into the saliva, but not all tick-borne diseases have that much time. So we're going to have to sort of see how that works, but it's a possibility that it could be applicable to other viruses. Already we have Lotilaner is also used in human beings for the mites that get onto the eyelids. So it has had some application. It's a little different. I won't get into the pathophysiology of it, but it's not completely unknown. But vets know this drug because we give it to our pets. For instance, we will give once a month, we'll give it to a dog to prevent the same idea, which is it's preventing the tick. It's killing the tick once it attaches, right? That's how this drug works. So we know that it works in dogs and cats. There's a drug called Credelio. Do you know that drug, obviously? Yeah, so you give it like once a month to a dog or cat, and that when the tick attaches to the dog, it dies within 8 hours because it has that effect of the GABA inhibition. So, but we haven't been able to see it in dogs tend to be very sensitive to this drug. We don't know about human beings. It hasn't been really researched yet. So it's in phase 3 of a trial, looking pretty promising. But again, I mean, do people want to take something like we give it to our dogs who are in the woods, but do we want to take it as human beings? So the question is, will human beings really take this drug over time? I think people who work and are exposed to ticks may want to take it. You and I, who may be walking our dog or walk in the woods for fun, maybe we will take it, maybe we won't. But it's a novel way of treating ticks rather than prevention through picking them off and taking antibiotics. This is another way of preventing, which is getting enough of this stuff in your bloodstream. The tick doesn't like it, the tick will die. Anyway, so there's a study, it's called TP05. It's basically the same drug that we were just talking about, Credelio for animals, being tried in human beings, and we'll see how it works when the trial's over. So let's see, is there anything else I want to talk about? I wrote some other stuff here that you can talk about. We don't know the dose yet. In fact, Pfizer is not telling us what doses they're actually using yet. We don't know if it's a low dose or a high dose. They're kind of keeping that pretty close to their vest. Study should be done in 2017 in terms of the research that's been done and whether it gets FDA approval or not.
Any questions for Dr. Chernin?
Yeah.
In your opinion, doctor, if these drugs do become approved, if you would, by FDA, would this be an over-the-counter drug or a prescriptive drug?
I don't know. That's a good question. I think it probably will be prescription. It does take a while for drugs to become over the counter. I would think that in the beginning, it would probably be a prescription drug because even though the side effects are minimal, I think still it's unknown. You're a pharmacist, right? So you maybe can add a little bit to this too. Because it's a new drug, it's experimental. We haven't had a lot of research on it yet. So my guess would be it would be prescription. That's what you think, yeah. And the question is, Natalie can give us some more information about what's going on in Lenawee County in terms of Lyme disease, how much we've seen recently.
Sure. So originally, we had, in 2022, we didn't have any cases. In 2023, we had 4, 2024, 8. Last year, we went up to 21 cases, which resulted in us becoming a high-risk county. So now that we are a high-risk county, our case definition and qualifications for every case that comes in had changed, which means we don't need a confirmed lab. We just need confirmed symptoms, which I ran the report today, and it's to date today. We have 22 cases already this year. So it's a significant increase. We remain high. A lot of the state is at a high level. The low burden counties, are of course a little bit upper. But yeah, since January, we've become a high burden county.
Yeah, as I mentioned, up to fairly recently, it was mostly seen in Menominee County, Delta Menominee, in the UP, which is kind of around the top of Lake Michigan, I think. And then the Southwest down near Saugatuck and that kind of area. And but it's come eastward towards us right now.
Is migration coming because of the host that they feed off, or
Probably, yeah.
like deer or so forth?
Yeah, they get infected, and I have a ton of deer on my property. I have
That's what I'm-
12 deer on my front lawn once. Unbelievable. So I can't believe I haven't seen more ticks, but I just haven't in the last 3 weeks or so.
I want to shoot all the deer because they eat all our flowers.
Oh, very interesting. Thank you for sharing.
Thank you, Dr. Chernin. Thank you, Natalie.
All right. We'll move on to existing business if there is any.
I do not have any.
All right, we'll move on to new business if there is any.
I do not have any on that either.
Okay. We'll move on to our program reports then. Personal health.
I just gave a little bit of the Lyme disease. Some other reports to give is that our clinics are getting busy with back to school requirements, respiratory vaccines, including COVID, flu, RSV should be available beginning October, depending, but that is what I'm anticipating at this time. Any questions for me? Thank you.
All right, we'll move on to environmental health.
All right, good afternoon, everyone. You have your typical reports in your packet. One thing in particular with food, I just kind of wanted to point out is we've had a lot of new places either open or we have a lot of new places that are coming, whether we've received plans or we've been told that they're on the way. We have a place, Golden Griddle, you might see on your report, is actually the old Big Boy. So that's been reopened. We were really happy to see. And then Rusty Rail Bar and Grill, that was the Weston Bar and Grill in Weston, not Grill, just Weston Bar. But anyway, we have seen the news about Chick-fil-A is apparently coming to Adrian. Seven Brew, I don't know if you've been by Meyer at all. That building was prefabricated. They rolled it down the road and basically set it down. It was really cool. So that's going up. And then we've also received word about, we actually have plans for Jimmy John's in Tecumseh, but that's going to be a plaza that is supposed to also have a Taco Bell, or not a Taco Bell. Is it Taco Bell? No, sorry, excuse me. It's a Dunkin', the Jimmy John's, it's a Domino's. And then I also was told a Tropical Smoothie is maybe going in there as well. So a lot of chain places that we're hearing about. Some we have plans for, some not quite yet. I'm not sure on the timeline for all of them, but just thought I'd point out, we like to see the new places, but also some of the old places getting some new life in them. So kind of going off of the Lyme disease talk, just a little update on Vector. I did chat with Cindy today and she said of the tick drags that we've done, we did not find any black-legged ticks. We actually didn't find a ton of ticks in general in the drags that we did this year, but I think, it just kind of depends where we drag, when we drag, and then also that we have yet to find of any of the mosquitoes that we have trapped, we have not found any invasive species of mosquitoes. So that seems to be pretty good and on track so far. And then beach monitoring also continues, had not had to issue an advisory yet so far this year. That will continue through the week of Labor Day as it always does. But then those two summer programs will pretty much be wrapped up here in the next couple of weeks. And then other than that, we're wrapping up just some of our other summer stuff, pool inspections, campground inspections. And then I also wanted to mention that apparently there's going to be an Adrian Mall Fair here in the next couple of weeks. I think I don't have the actual date, but we got a ton of applications for like a temp campground and all the food and stuff. So just keep your eye out for that because we didn't see any advertisements for it. And then all of a sudden it was like, there's going to be a fair in the Adrian Mall parking lot. So
There's some great things going to be happening at the Adrian Mall.
I looked up the website today because I didn't realize it's the Howard Center is now what they're going to call it. So yeah, there's a whole website with all this stuff. So yeah, I had no idea until I looked it up today. But anyway, there's going to be the fair. I think it's sometime in the next couple of weeks. Yeah, fingers crossed. Right, exactly. So that's all I have unless anybody has any questions for me. Yeah.
I saw in accounts payable, accounts payable, Big Boy Restaurant Group refund request for temporary food license.
Oh, that's not Big Boy as in like the restaurant. It was a temp food that has that same name. They have a couple different, I don't know if they're trucks or tents. It was for, I think, the race. So it took us a while to get they're supposed to have 3 units and then one broke down. So we ended up refunding them for one. I think it just took a while to get in contact with them and get that refund process. So not the same Big Boy.
All right, if there are no other questions, we'll move on to emergency preparedness.
Emergency preparedness is quite a few trainings and drills for Michigan Voluntary Registry. And then also been working with Region 1 for identifying public health's role in mass fatality. So we are busy trying to get a template around and identifying what support public health plays in mass fatality.
All right, any questions for Monica?
No questions, a comment. If you're talking about emergency preparedness, if you've a little time after the meeting in Blissfield, there's what's called the prop train came in. And the prop train is a demonstration or training device to how to attack hazardous waste or chemical spills or whatever. They can even do a derailment exercise. I thought it was like 2 or 3 boxcars. It's like 15 of them. And they have tanks and compressed tanks and all kinds of stuff. And you will see there tonight all the drones that Lenawee County has, about 7, 8 of them. Bunches of fire departments, the hazardous materials truck all going over there because they'll simulate all these activities. And then they will learn how to, the staff that brings it in also instruct people on how to do certain things. It's really kind of a neat thing to see.
That's going on right now?
It will, 6:30. Yeah, 6:30 is the nighttime exercise. They just did one this afternoon.
Oh. Neat.
All right, very good. We'll move on to finance.
Hello. So our fiscal year ends on September 30th. Our state budget was due last month. It's always typically due around the 4th of July. Our county budgets were supposed to be more in line this year, but they've been postponed slightly. So we are entering our county budgets this week. I believe that they will be taking their preliminary efforts to the board next month. And I also attached our 3rd quarter FSR report. We are at about 65% of our annual budget as of 3rd quarter. So we are doing really well as far as spending. We are coming in lower than what we anticipate as far as our quarterly expenditures. Are there any questions for me?
Budget will go to commission for approval in October.
We'll go in October.
Just reviewing.
Yeah, I believe they have to have a month for public comment. Any questions? Thank you for clarifying that, Terry.
All right, we'll move on to public comment.
I'll just share the Adrian Police Department on September 3rd is doing a scam prevention and awareness presentation in the city chambers. They have 2 sessions, 10 a.m. and 10 to 11, and then 1 4 to 5. So can help advertise that. So that'll be helpful.
What was the date?
September 3rd.
Okay.
And what's the purpose?
To go over like scam prevention and awareness and why scams work,
Oh, okay.
most commonly seen scams, and how to stay safe, what to do if targeted, and then a question and answer.
Okay. And where's it held?
Adrian City Chambers.
Adrian City Chambers.
Not City Hall, the chambers of the
Yeah.
commissions.
All right, if there's no other public comment, then I'll look for a motion to adjourn.
Sport.